Hi, everyone. It's Stephanie again with the patient story. This is video 2 with Dave, who's sharing his lung cancer experience with us. And Dave, thank you. You just wrapped up talking about, how you got diagnosed and some of your treatment decisions. You walked us through those. And now we're going to talk about the actual surgery. So if you could remind us, one, I guess, how your doctor, and what kind of doctor did you have? And how did he or she explain how the surgery would go?
Well, this is actually a really interesting, this is a fun part of my story, actually, very positive part of my story because my primary care physician really he knew me well. He knew I was, was some kind of Minnesota nice, and I was would appreciate, I'm always engaged with my medical team, and so he knew that picking the right surgeon would be really important to me. And so at a place like Mass General, there might be 7 thoracic surgeons who do the type of surgery that I would be required. So the first step, my doctor, he sent me to meet with some respiratory physicians. And again, he handpicked because he knew I would really like them, and they kind of explained what the process would be like. And then he picked my surgeon, and my surgeon was Doug Mathieson, who at the time was the chief of thoracic surgery at Massachusetts General Hospital. So, and the reason, two things. First of all, it's very interesting because he's the chief of the department, which means he's the man. But they're all good. But the second thing was that he played college basketball at the University of Illinois, and he was a Midwestern guy, and very outgoing and very nice man. And my doctor said, he even told me, he said, "You're going to love him." And so then I got to go meet with Dr. Mathieson, and he was so amazing. He sat me down. He had a whiteboard, and he drew the lungs, and he's like, "Cut to this, and we're going to do this," and he really kind of explained the process. But but the one thing he didn't, I guess he didn't prepare me for. In some ways, it was a good thing that I didn't know. I had never been under anesthesia, so I'd never had a major surgery, so I didn't really know what that was going to be like. And so I was kind of like, yeah, da at the day of the thing, I'm nervous and whatever, but I wasn't as nervous as I would be in future times when I had to go back under anesthesia for bronchoscopies. I was a nervous wreck. So um, I think it was difficult to actually to prepare for how you would feel after a 4.5 hour surgery coming out of anesthesia. What because it was I was in so much pain and so disoriented. It was awful.
Oh my gosh. Yeah, it sounds like it. It was a very intense surgery. Was there any prep leading up to it? Like, do you remember, did you have to fast? Did you do an early morning surgery? I know sometimes people talk about, well, I want to do early morning because I want the surgeon fresh, or,
Yeah, yeah. I should emphasize it was an early morning surgery. I had to be there at 6 a.m. So you fast the night before. I forget the number of hours, but you're told that you can't have anything after a certain time, and then you show up, and then you're kind of called, and it kind of based on. I think I was the first surgery of the day at that particular time, so that was kind of cool. So, but I will say, I'll go back to what I said earlier about not being super stressed. I actually was. Now that I'm remembering the night before, because my parents and my brother had come into Boston to visit me, and then they were kind of like, "Hey, it's going to be great." And I'm like, "No, it's not." I was like, so I remember thinking when someone, if ever says, "Oh, you're going to be fine. You'll do great. It'll be nothing. You got this." It's like, yeah, really. I'm not so, and because it's me that's happening to, so it was kind of hard to sleep the night before and everything, and sitting in the waiting room when you actually show up to the hospital and you go to the surgical unit. um,
Right.
it's like then it becomes real, right? Things just got real. Then you go in and you sit down with the anesthesiologist, and you get changed into your gown and whatever, and then that starts the communication of the anesthesia person. And again, another person that was chosen by my physician, which is very cool. So,
Mhm.
you really can, if you have that, if you think to be proactive of the people who are caring for you, you can help navigate the system, or someone can help on your behalf. If you're not that type of
Right.
person, someone who's one of your caregivers can help navigate through that.
It's a great point, right? There's so much on your plate as a patient. emotionally you're trying to digest, or you're trying to get through it, period. You might not even be processing anything. So to be able to delegate is very important, to understand who in your circles would be able to handle some of these tasks. So for you, luckily your primary care physician knew, and he worked at Mass Gen and was able to help be that person for you. A lot of people won't have that. So maybe if you have your partner, your spouse, an adult child, anyone, your recommendation is have them look into the right people you should be seeing in terms of the medical care.
Yeah, and again, it's the comfort level of the patient, like
Mhm.
everybody's different. Everybody's, I'm married to a nurse, and so, and her
Right,
dad was a pharmacist, and so we kind of are very engaged in the process, and other
right.
people is just caught by by surprise and like, oh my
Yeah,
gosh, what do I do now? And I have no experience in this, and I don't know what to do. Who do I turn to? And so, that's where I think, whether it's your family, a family member, or a close friend, I do believe it's super important to have someone to help you navigate. Even if you're good at it, it's always good to have someone else, helping you navigate. And that's where we talked a little bit earlier about finding other patients, who have been through the similar experience. And now it's very easy, not
yes,
always, in case if you have a rare thing, but
right.
it's much easier to
Easier.
find other people.
Yeah,
Yeah.
right. And this is related to, not just finding the right maybe medical care, but even when you go to appointments, right? You hear it's like have other people there with you, an extra set of eyes and ears. It's really helpful, because again,
Well,
you're overwhelmed, right?
I've heard people, it was in, maybe it's in one of your patient story videos where somebody mentioned, that once you hear the word cancer, like you almost like you don't hear the next words that come out,
Right, totally.
and so if somebody's sitting next to you, you know, this might be good to have them, to taking down information about it, because it can be very overwhelming.
Yes, yes. And another tip I've heard from people, and I'm sure you have too, is as long as you just tell the doctor, is it okay if I record this? And you just record the conversation so you can play back later, and it takes the pressure off of having to, take in everything that's coming at you in that moment. So
Yeah.
these are all great tips. So Dave, I know you said it was 4.5 hours of surgery, and of course you were under for it. What do you remember about waking up? I know it was quite painful. If you could walk us through just how you were able to recover in the hospital, and any guidance you have for people on what helped you through a pretty long hospital stay.
Yeah. I remember exactly. I remember waking up and my lips were really chapped. And I was sitting looking up, and I was in a recovery room, but everything was very loud. It was very loud. And I was like, it was probably amplified. The voices were probably, people weren't talking loud, but even just talking in a normal voice, it was so loud. I remember being disoriented as to, and I remember looking up and saying, is anybody there? Help. And I was like saying help, like, because I was just disoriented, and the noises were confusing me. And, the chapped lips, because you have the thing in your mouth the whole time. So, um, but then um, I remember kind of the process of going and settling into my room, and then trying to find like a comfortable. You have to kind of sit because you have a chest tube, which is like it's like I call it like a garden hose. It's like this huge tube that for the drainage of liquid uh, out of out of your chest, and it's super painful. And so it's kind of like right here, and you have to sit at an angle in the bed. So you can't sit on your back, you can't sit on your stomach, and you can't really be on your side. You're kind of at this weird angle. So you have to kind of prop it up with a pillow. And then they have the morphine drip, and you have a drip. If you don't know what a morphine drip is, it's you have the medicine, you can self-administer, you can push the button, but it's on a timer. So you can only get it like every 7 minutes. You can't just constantly get it. But I remember just hitting it like all the time, because I couldn't wait for the next minute. And by the way, it makes you sleepy and, you know, kind of out of it. So you don't really see and feel like kind of things happening around you, but it doesn't take the pain away. It dulls the pain, I'll say. So, and then as the process goes, every day, it's like the first day you have to get up because you can't sit there. You have to start you moving. That's part of the start of the recovery. So they come in every day with a portable x-ray thing, and then they have to get you out of bed. And so you have to stand up. The first day I remember I stood up and I think I took like 1 or 2 steps, and that was literally it because it was so painful. So I back in my bed. And then the second day, it's like I make it to the edge of the door of the room. And I remember thinking, um, I want to get to, around the unit, by the end of the week or whatever. And I actually ended up getting it. I ended up making, because then you walk with your, with your bag around the floor. But I remember thinking, you just got to get through this. And the nurses were amazing. There was one nurse that, because they wake you up in the middle of the night to do physical therapy. They have to, they hit your back, and so, they'll wake you up at like 3 in the morning. It's like, it was cool because they let my wife sleep there. So she was in a chair next to me. But I remember her just being one of this in particular who was on duty that week, in the night shift. She was just brilliant. And um, I wish I would have been more proactive in remembering her name and all of that, to be able to thank her. But anyway,
Yeah, it's
yeah.
incredible everything that goes into. I mean, I remember getting woken up. If it's not for physical therapy, it's for taking your vitals or whatever, and you're like you just fell asleep or something. Um, so along those lines, and we'll talk about your wife. As a caregiver, I know it's a huge aspect of all this that doesn't get enough appreciation. But what helped you? I guess you're recovering. You're in pain. You're constantly getting up, having to move around even if you don't feel like it for your own sake. They're testing you, they're giving you therapy. And in general, after any surgery, I know they want people to be moving around, so that they start to build up their energy and
Mhm.
muscle mass again. What do you think might help people who are going to go into this kind of surgery? I mean, was there anything that helped you get through it? It could be anything from medication, or it could be bringing a pillow from home, or anything that you think might be helpful here.
I think for me it would be, understanding ahead of time to get yourself into a mindset, of how invasive the surgery is, because people might think of a lung surgery because nowadays they have these laser surgeries they can do and stuff. But a lobectomy, they still do lobectomy. I mean, lobectomy is, they make a big incision in your side, and they break your ribs basically, just like open heart surgery. So if you ever had a broken rib, you know how painful that is. So um, I think the I think that the recovery after outside of the hospital is probably where I can share with people that if you're going to be told what to do in the hospital when you're in the hospital, right? You're going to have to
Right.
get up at these times. You have to walk, and they're going to give you the pain medication. But once you're home, I remember getting
Mm,
home and walking upstairs to the bedroom was excruciating. I could barely walk. It was like I was a 90-year-old person walking up the stairs. And I remember laying in the bed, and every time my wife even would just sit on the bed, it would just hurt so bad. It was like, so it just, that part of the journey is really about taking that mindset of, you got through the experience in the hospital, now you're home, and you're probably not going to remember a lot of the time in the hospital, honestly, because of the medicine. But getting yourself in a mindset where you have to just get through the next, I think I can't get to Saturday till I get through Friday, and I can't get to Friday till I get through Tuesday, and I can't get to, and I broke it down into like these little windows of time. I can't get to 5 o'clock till I get to 3 o'clock, and I can't, and it broke in almost like 5 minutes, 5 minute segments. In other words, I compartmentalize it to try to say, I can't think of the week from now or a month from now. I'm in so much pain. I just have to get through the next 10 minutes,
right. Right.
or until I get my next Vicodin, because
Yeah.
it'll be wearing off in 4 hours, and I have to take another one. So, and it's not a woe is me thing, by the way. This is not
Mhm.
a woe is me at all. I'm so grateful for the experience that I had, and that I didn't have to make decisions on targeted therapies or immunotherapy, or what stage and who should I talk to. And oh my gosh, there's so many people that I know that will talk about it in my advocacy work. So I don't mean to make this sound like I'm complaining about it, because I'm
Mhm.
definitely not. I'm just kind of share my what to expect kind of thing, because once you're
Absolutely.
done,
Right.
there's no doubt that the feeling of gratitude and comparing my experience to others who have it way worse than me.
Mhm.
And at that time in 1998, the life expectancy of someone with lung cancer was really bad.
Right.
It's improved, still not good, but it's way better than it was back then.
Right. No, I can only imagine having to deal with those numbers at that time.
Yeah.
And I didn't get any sense of woe is me. I think it's great for people to understand. First, of course, everyone tracks differently, right? Their responses are different, but that surgery is a very, it's a big one. It's one that it's great, I think, for people to just be prepared that recovery isn't, oh, I was in the hospital for a week and then I was discharged and then boom, I'm okay. I mean, you mentioned you were in recovery for a couple months at least, right? Maybe even longer, maybe a few months. Can you describe, maybe just sort of summarize the recovery at home and what helped you through it? I know one thing you said was sort of like living in the moment, right? Don't try and you didn't try and think too far in advance because you can't control that far in advance. So you were very focused on this is what I can do now. What else was there that helped you in your sort of toolbox recovering at home?
Yeah, I think I was lucky because, I had a caregiver, my wife, that just made everything easy, and with my work I was able to have people cover for me, at work. But I did start to get back to doing some things, work wise, after, I don't remember the exact number of weeks or whatever, but um I remember thinking, kind of setting goals, of like going downstairs, like, as it took me a while to get down the stairs because it's really hard. Believe it or not, it's just even that, you know, low impact. But I do remember when I finally went outside, and it was awesome because it was kind of late spring, or spring, and my neighbors, saw me walking on the street, and they're all like, "Dave, how you doing?" Because I literally hadn't been out of the house, for for a long time. So I think everybody copes differently with, that, kind of getting through it. But I just encourage people to, I believe in positive attitude, and I do believe that that helps, in the recovery, whatever treatment that you're getting.
Right. And I'm going to pull up a picture. I'll try to pull a picture of you and Missy, your wife. The caregiver aspect, especially after a surgery, a major surgery, how important is it to have a caregiver? And yeah, do you have any tips for people on how to manage that part?
Yeah, I can tell you that, uh, a big thing for me is I think people, I could have done a better job of appreciating my caregiver. I think that's one piece of advice that I always like to give to people, is to make sure that you take care of the caregiver, right? And now the patient, I think, is locked in many times of the treatment and trying to just make, get themselves emotionally ready. But I can share my experience. My wife, as a caregiver, she did everything. We had 3 little kids. She was making, she was feeding them, getting them to school. She was I'm just literally doing a single parent work that was just thrust upon her, right? Worrying about me as I would if she was in that situation. And so emotionally, it's so hard. I mean, she was sitting even in the patient lounge during my surgery. Thankfully, she had a friend come with her, to visit, because she was an emotional wreck. So I think it's important to recognize what the emotional experience is for a caregiver. And it's not as simple as, well, we can get people to help make dinners and that kind of thing. It's like, no, it's a whole package, a whole emotional experience that someone goes through. And I just told someone the other day about this. If I had been reversed, if I had been the caregiver, my wife was in that hospital, I know she would have been emotionally devastated by, oh, there she is. She would have been, she would have been emotionally, uh, in a hard place, tough place, because of not being able to take care of the kids. But thinking about what it would have been like for me to be the person taking care of everything while she was, down and out. So that's the best, I think, the best advice that I can give. And patients, we can do, as patients, we can do that. We can make sure we're just be sensitive to that, right?
Absolutely. Yeah, I love that message because caregivers are so focused on the patient. Everyone in your circles are asking about you, the patient, not the caregiver. So yeah, having more attention paid to the people who are have so much on their plate, right? Um, is so important.
Taking care of the caregiver. That's right.
So I'm glad I could finally show Missy. That took a little bit. Um, yeah, is there any last thing about this portion? I guess you did also mention your boys. I'll pull up a picture. They were, you said 5, 3, and 1 at the time. Do you have any guidance for parents, on dealing with how to handle cancer with kids? Now I know your kids were pretty young at that time. But maybe the 5-year-old, did any of them understand that dad was going through something pretty serious? Or
I don't think I don't think they really were old enough to really understand what was happening, or how serious it was. But I think as my kids are older now, because they're in their 20s now, I think of if that had happened now. I laugh when I see that photo. I think of if that happened when they were teenagers, or if it would happen now.
right,
I think I think that's every family would have to really think about, you know, how do you have that conversation with your kids, because particularly the ones I have friends of mine who, are in stage 4, and metastatic lung cancer.
mm,
And, that's a really hard thing for kids to get their arms around, because, they know the parent is likely to not live a long time. I mean, some are, living a lot longer now, but it's yeah, I think from my experience, they were too young to really, be worried
understand.
about it. Yeah.
Right, right. Do you have any tips for care? I mean, your wife was now having to, also take care more of you. Any guidance there in terms of just ask for help wherever you can?
I agree with you, Stephanie. I believe in asking for help. I think, as a caregiver, um, I do remember some friends of mine who stepped up, not even being asked to step up, that just were amazing, and I'm very grateful for that. But I think it's okay to ask for help. You probably get friends who will say, what can I do? Hey, let us know if you need anything. And and this isn't even really just in cancer, but when somebody says, let me know what I can do to help. And it's like, how many times do we not ask them for anything, right? And
Right.
it's the one time, if you're a caregiver and you have, a loved one that's in the hospital, or is undergoing chemotherapy, or undergoing, serious treatments, on a regular basis, or in a clinical trial or whatever, and you're just emotionally out there. Like, it's okay to accept help from your friends, right? I mean, I'm sure you would say the same thing from your experience.
Yeah. Yeah. It's so interesting. It's hard sometimes to make that leap. We try to put some, pieces out there about for people who want to support, maybe be very specific. Don't even leave it up to people, right? Don't say,
Right.
let me know. It's more like, hey, I'll bring over some food or whatever it is.
That's right.
But thank you, Dave, for summarizing and sharing your entire lung cancer experience. I'm really excited to get into this next clip now to talk about the advocacy work. And again, that's because you've been doing it for so many years, and even have a podcast launch now to try and help patients and caregivers. So hang tight. We're going to stick with Dave for more on things patients and caregivers should know and his advocacy work.